Hi, I'd like to welcome our audience today. We're here in the library at the Buddhist Door International offices in Hong Kong, and we're honored today to have a guest with Dr. Barry Kerzin, and he has been invited to Hong Kong to do a number of things in this week, and we were grateful that he's come by today to talk and explain a bit more about what he does during the year. As you can see from his dress, he is a Tibetan monk. His name is Tenzin Chorab, and he's also a Western medical doctor and teacher. Based in Dharamsala most of the year, although these days he's traveling many months around the world to lots of different locations that we're going to hear about today. So, welcome, Dr. Kerzin.
Thank you.
Well, let's start with Hong Kong, because you've been invited to come to Hong Kong this trip. And tell us a little bit about what you're doing here on your visit.
I've just been here a couple days, enjoying the weather tremendously and the kindness of the people tremendously. As I walk around and get lost and ask for directions, people have been very kind to not only tell me which way to go, but kind of accompany me often. My invitation here, firstly, was through Professor Elsie Chan at the Hong Kong University Medical School to give a lecture in their humanities program.
The Center for Behavioral Health has invited you to speak to their medical students. Why do they feel that it's interesting for you to come as a monk or a doctor or a teacher? What is it that they're hoping to learn from you on your visit here?
Yeah, Kathy, wonderful question. I don't know fully because I haven't been yet. But from reading their website and brochures, it seems to me they have a very advanced program within the medical school teaching humanities. And what that means is human values. It means love and compassion, respect, honesty, integrity, at least as I interpret their website material. And these are incredibly important values for all of us, but also very important for physicians. Because if we don't have respect and, treat our patients with kindness, gently, then they're not going to trust us. If they don't trust us, then actually our immune system doesn't fully kick in to fight disease. So actually, garnishing trust is actually beneficial for the immune system and therefore is actually very beneficial in healing.
It's interesting that a Buddhist monk would come in to teach medical students about trust and tapping into that. It's almost like a short course in bedside manner. But is this really lacking in the medical schools, that they need to address this and actually teach more compassionate gestures to people in the healthcare fields?
It's very important and very necessary. Unfortunately, as in much of our life, things get very busy and crammed. So medical schools tend to be very full of delivering information to young budding doctors. And in that process, somehow this kind of human touch aspect tends to be neglected. It's being recognized more and more. There are many medical schools in Europe and America, and now I'm very impressed with the website for this program that Professor Elsie Chan is running at the medical school here to bring more of that into the medical education. Actually, if you query most medical students or even doctors, you ask them, why did you choose the profession of medicine? Many of them, often a majority of them, will say they wanted to help others. And yet with the process of education being so rigorous, often and more technical, often those kind of initial motivations become a little bit background quiet and almost forgotten. So what we're really, through this kind of process of bringing compassion and humanities into the medical education, we're trying to rekindle that initial aspiration for many people to enter medical school and the profession of medicine.
Yeah. I understand. I mean, you've been invited this time to Hong Kong, but have you traveled and been invited by other medical schools in other parts of the world to share this?
Yes, many places. I go regularly annually to University of Central Florida in Orlando, in America, USA. In Russia, I visited in many parts of Russia, Moscow, South Russia, Kalmykia, Siberia, Tuva, visited their medical and dental and nursing schools. In Mongolia, I've visited also been invited to their medical schools and nursing schools. So in many different countries in the world, I'm kind of bringing the same sort of message as a doctor, as a Buddhist monk, to bring more, compassion, which is structured around trust, honesty, integrity, and respect to the practice of medicine, particularly to those young doctors in training.
Yep. On that note of compassion, I understand that you have a working relationship with the Max Planck Institute in Leipzig, in Germany. And are you in the process of working with them on some program that, or consulting with them about a program called How to Teach Compassion? How does one teach compassion?
Yeah, this is a really pregnant question because more and more research, medical research and neuroscience research has been showing that actually compassion is beneficial to our health. Not only our mental health, which we all, I think, know, but also to our physical health. And so with that background of research showing that this is actually beneficial for us to practice a more, compassionate way of life, then how do we train people or teach people to enhance that? We all have this biological compassion, the mother for the child, the father for the child, for our loved ones. We have this innate, almost, biological compassion. So how do we nurture that? How do we embellish that? How do we make that grow to encompass more than just our family? And so that's what this large research project is looking at through the Max Planck Institute in Leipzig. I'm a consultant on that very large project, which will stem many years, will go over many years. And some of the methods that they're looking at are, number one, forgiveness, teaching people how to forgive. And by letting go of grudges and forgiving, often it may affect the other person, but often the most profound effect is on ourself.
On the actual person who is releasing to forgive.
Exactly. It really opens the doors for much more love and compassion. So that's one avenue. Other avenues are, training in understanding. This is more of almost a cognitive kind of approach, which is similar in psychology, cognitive psychology, is to try to understand where the other person is coming from when we're in a difficult relationship or having a difficult time with someone else. Our normal knee-jerk reaction is to kind of withdraw or to go forward with aggression. Both ways, there's anger involved. This is not healthy. We know from medicine that anger brings about more medical problems. We talk about type A personalities, people that get angry a lot. They definitely have more heart attacks and die earlier. They have more problems with alcohol, heavy alcohol use, have more problems with accidents, often ending in early death, and many other problems with anger. So how do we control the anger? So that's another area, working with trying to become more patient in those difficult situations where we're prone to anger by trying to understand the other person.
Right.
So we may not know what's happening with the other person, but we can think, what are the main things that get people out of balance?
Right.
Number one, it's relationship problems. So maybe the boyfriend or the girlfriend said bye-bye. Or economic. The boss said, we're in difficult times, we're cutting down and we have to let you go. Or health problems. Just went to the doctor and the doctor gave so-called bad news, some health problem that. So we can think that way. Maybe that person has had some of those things happen recently, and therefore they're out of balance, and therefore they're in my face. And just thinking this way gives us some space, some distance, so that we don't have to automatically react through anger, but can develop some tolerance, patience, and even possibly compassion. So those are a couple methods. There are others.
Will you be approaching adults with this material, or will you consider to be teaching this to children or to families? Would you have an audience of teachers for this that might actually take compassion and understanding into the classroom too, capturing young developing minds also?
Yeah, this is a wonderful question. This project out of Leipzig, Max Planck Institute, is looking at young adults primarily, college students primarily. But this whole issue of training compassion is not limited to that study. And in fact, there's a lot of work now being done developing curriculum to train compassion, starting at K through 12. And that's starting to happen in some school districts in America, Europe, and other places in the world. And what the Mind and Life sees as one of its visions, one of its goals, is to do the research. And if the research bears out that positive ways of thinking, of acting, such as being compassionate, being kind, having a warm heart, if these are actually beneficial for the individual and can scientifically be proven, which now there's a tremendous amount of good research published in the highest level journals like PNAS, the Proceedings for the National Academy of Science, the journal Science, the journal, some of the best, Nature, some of the best scientific journals in the world in English language. This research is being published there, so it's very respectable now. And so now that information is being used with the educators, the professional educators, to then begin to develop curriculum to train for these sort of positive states of mind.
Right, so taking it from a scientific level, it will move through academia, move through administrative channels and into the general public to benefit more.
Yes, it gains the credibility then.
Yes. You have a long-standing relationship also with the Mind and Life Institute, and I understand they meet every summer in Garrison, New York. Scientists come together, interns come together, all kinds of students and academics come. What do you gain from meeting with them every summer in New York? Are there threads that follow every year? Are you participating in a specialty area? What's your relationship with Mind and Life?
Yes, I'm a faculty member.
Oh, you are, okay.
Mind and Life. And this, as you refer to the SRI, the Summer Research Institute, is being held every year in June at Garrison Institute, which is mid-state New York, about 1 hour train ride north of the city, New York City. And it's a gathering at an old Benedictine or Trappist monastery. It's a beautiful setting. It's on I believe it's the Hudson River.
Hudson River it is, yes.
And it's just a gorgeous setting.
Yeah.
And the food there is all vegetarian and organic, and much of it is locally grown. It's very peaceful. And we have a gathering of about 200, mostly are scientists. Most of the people are neuroscientists, brain scientists. Okay. But also there are anthropologists, there are psychologists, medical doctors, people from the arts, other fields in the arts. And there are also some monastic people within the Buddhist tradition, some monastic and non-monastic in the Christian tradition, in the Hindu tradition, and so a variety of spiritual, religious traditions of people come. And basically it's a science program structured around giving talks. Interspersed is meditation. In the morning and the evening, we have a meditation.
For all the participants?
All the participants. It's voluntary. It's early in the morning, and everybody comes. They love it.
Yeah.
And then on a Wednesday, in the middle of the week, it's a week-long conference.
Okay.
In the middle of the week, we have a day in silence, and we do meditation all day. And so it's a kind of mixture between a spirituality, inward approach to life, and a more scientific external approach to life. It's a place where the two meet in a very gentle way. So for me, it's been very enriching because these are two aspects of my life. I'm a scientist, trained as a medical doctor in medical science, and taught at the university for a number of years in Seattle, the University of Washington. So I have a little bit of an academic background.
You also were a teacher at the medical school there.
At the medical school at University of Washington in Seattle. And of course, I'm a Buddhist monk. So these two worlds, which I am involved with kind of not usually simultaneously, but at different times, come together for a week in June at the Garrison with the Mind and Life Institute. And I love the inspiration, the enthusiasm, the tremendous kind of intelligence of the young people that are there. So it's very stimulating for me, and I have a great time. I've been to most of them. This will be, I think, the 8th year coming in June. I'll be going to that also. Often I lead what are called breakout groups. So there'll be different breakout groups people can choose, and they haven't given me a topic yet for this year, but I'll be doing that in June at the Garrison this year.
When you go as a speaker to different medical groups, how do they respond to your being a Buddhist monk? Because obviously in the medical school environment, you would meet people of all religious backgrounds and traditions, or non-religious for that matter. And do you find that they respond oddly, nicely, surprisingly? How do they respond to you as a monk?
I get all kinds of responses. But when I'm in the medical schools, I don't go as a Buddhist monk.
Oh, you don't?
No, because in most countries in the world, particularly America and Europe and Japan, you cannot bring religion into the schools. They're very strict about that. And so I don't, of course.
Okay, so you go in layperson clothes.
No, I go dressed as a Buddhist monk.
Oh, you do? Okay.
Yes, I mean, I am a Buddhist monk.
So you appear that way.
I appear that way, but I don't talk as a Buddhist.
No.
I usually talk about secular ethics, which are not based on religion, so I don't use Buddhist terminology. In most medical schools I go. Now, there are exceptions. When I'm in countries that have primarily a Buddhist, the people are primarily Buddhist, then of course I go as a Buddhist monk also.
Yes.
For example, in certain parts of Russia, some of the federations are Buddhist, in Buryatia, in Kalmykia, in Tuva. I then will go as a Buddhist monk and doctor to the medical schools, nursing schools, etc. Same in Mongolia. But in America, North America, Europe, in Japan, I don't, even though I go in robes, I present myself in a secular way, in a non-religious way.
Well, actually, I mean, the topic of compassion and forgiveness and anger and emotions are not exclusive to any religion. They're human qualities that you're trying to address, and that, regardless of what you have on that day.
Exactly.
Yeah.
Even beyond human, into the animal realm also. But unfortunately, we can't have much dialogues with the animals. I mean, some people have very close relationships, but it's hard to have a language dialogue.
No, if only we could talk to the animals. Wouldn't that be nice?
And if only they could talk to us.
That's right.
Recently, I saw an article about, I think, sperm whales, huge whales, kind of adopting a dolphin who had severe scoliosis, so the spine was quite deformed. And the people who observed this, who were kind of biologists, they assumed, they don't know, they assumed that because of the deformity in this dolphin, it couldn't keep up with its group, and was spotted by the sperm whales, who kind of kept it inside their little pod and protected it. They observed this for several weeks, actually.
It's amazing how much we don't really know. We can witness, and yet we don't know the real truth, but it's very nice to hear those kinds of stories. You also have another project that you're involved with, particularly in Japan, and you're part of it, or you founded an institute in Japan. We would love to hear a bit more about how that came about, what it's involved with the Japanese people there. If you would share with us a bit more about your institute there.
Yes, 3 years ago, we founded this institute called the Human Values Institute. There's a website in English and Japanese. I'm the chairman of that institute. And we basically are doing a number of different kinds of activities under that umbrella of that institute. I'm coming to Japan about 3 times a year, 2 or 3 times a year. And recently, we've been having these annual symposia, and we've had 3, and we'll be doing a 4th one in the end of April on the island of Hokkaido. And primarily, these symposia have been dealing with consciousness, mind. What is consciousness? And trying to tease that out because it's quite complex. And often our modern education doesn't deal so much with that issue, and yet it's so central to our lives, our mind, our consciousness, our heart, our emotions, all that's included. So we do a lot of education through symposia, and the symposia we invite a number of people, sometimes medical people, sometimes we have a professor of Buddhist studies from Kyoto who's been a regular with us. We have a dean of the Cyber University in Tokyo who's more of an IT person but very open to also artificial intelligence in addition to consciousness, and he's an amazing participant. We have other people that come and join us at different times, and in addition to that, I lead through the Human Values Institute sacred pilgrimages on the island of Shikoku. There are 4 islands in Japan. I mentioned Hokkaido, where I'll be in April, the northern island. The southern island is Kyushu, and I spend a lot of time in Kyushu teaching, primarily in Fukuoka at Hitsatsuni Hospital, a group of doctors and nurses. And there I'm actually teaching Shantideva, which is a Buddhist text, an Indian Buddhist text that comes from the 8th century. And I've been teaching that there for about 5 years.
Now, why do they find learning about Shantideva interesting and useful for themselves?
Compassion.
Yeah.
Yeah, there's so much richness in that text about how to develop compassion directly through trying to open up our hearts directly, and indirectly through reducing anger. So there's a whole chapter in that text about patience, which is to reduce anger, and then also about how to deal with, how to expand our compassion to not only encompass those that we feel comfortable with and love, but also to strangers.
Yes.
And then going further, also to those that we have trouble with, so-called enemies.
Right.
And so that's very rich in that book, and I think those things are very poignant for them as health professionals.
So there are different concentric circles of expansion on the notion of extending compassion outwards.
Yes.
From the intimately familiar to the moderately familiar to the unknown.
Yes, and one of the methods that we use to do that is to recognize kindness in others. So most of us, we recognize kindness in those we love.
Yes. Easy to do.
Easy to do.
They're right in front of us.
They're right there, and they're being kind to us, at least much of the time, maybe not
Yes.
all the time. So we can recognize it and reciprocate in kind. It's more difficult to see kindness in those we don't know, strangers. Maybe we see their face in the supermarket or on the metro, but we don't know them. So to begin to recognize that everything that we utilize in our life, starting from our cup of tea, our glass of water, to the metro that we ride, to the roads that we ride on in our cars itself, the airplanes, our clothing, this library in this beautiful temple, all these things didn't come out of nowhere. Yeah? They were the product of human invention and hard work and labor. And who are those people that invented and gave the hard work to produce these things that we use every day and we need for our survival, our clothing, our food, our shelter, etc.? It's all those people and animals sometimes who are strangers we don't know. So thinking about strangers more in this way, that they help provide everything we need to survive and thrive, then we can begin to appreciate the kindness in the other, the so-called stranger. Then the third category, the so-called enemy, okay, most of us, I mean, all of us get angry sometimes. There's rarely a person that doesn't really get angry. And most of us don't like that. We feel that we're taken out of our kind of place of harmony, our place of balance when we get angry. We don't like it. So we'd like to reduce that. How do we do it?
Yeah.
Well, the way we do that is, when someone is actually in our face, to practice patience.
That's a hard thing to do.
It's a very hard thing to do, but it requires the person in our face.
That's true. You have to have that person there first.
And in that sense, that person becomes a teacher of patience. So we begin to reframe that so-called enemy, the one we want to walk away from, as actually a teacher. We don't have to tell that person, but we begin to relate to that person as a teacher or a potential teacher to help reduce our anger. So in that way, we can see kindness even in the person that's in our face. And so that's one way to expand our compassion beyond just those that we feel comfortable with and love and good friends, etc.
So, like for instance, as a simple tool, in a moment of that anxiety, when an angry person is in your face with a conflict, and you feel your sort of energy rising very quickly to match theirs, is there a quick tool that you could offer to do that? Do you stare the person in the face and think, teacher, moment, calm? How do you go about that from a practical point of view?
Yes, lovely. When the anger is full-blown, and that's the situation you're presenting, not much we can do with it.
No.
Probably best to try to walk away.
Okay, so disconnect from the elevated energy would be a good step to start.
Yes, but that's not the main method.
No.
The main method is to learn to identify that anger when it's incipient, when it hasn't fully, blossomed yet.
Right.
That's the trick. Once we can recognize, I just don't feel so well. I feel a little bit irritable. I'm a little fidgety. I feel like I don't want to be here in this situation. Identifying early the anger, and you say, oh, maybe anger's coming. Then you apply this understanding, that the other is actually a teacher, a potential teacher for us, and that I don't want to become angry, and I have other tools. I can try to become patient, okay? And by being patient, I try not to react with anger, on the one hand. On the other hand, I'm not just suppressing, because suppressing doesn't work.
No.
It doesn't get rid of it, because that anger is still there, and another moment it'll explode.
Right.
So suppressing that feeling of anger doesn't help. It's really trying to transform it, to really change that incipient, that early anger, change it into this tolerance and patience. Mm-hmm. Now, that doesn't happen when we apply this once.
No.
Yeah.
Sounds like a practice to develop.
It's a practice. We have to do it over again and again. But I can tell you from personal experience, it works if we're persistent. So
when you're teaching people, are you teaching them meditation or calming the mind so that they intuitively or instinctually are more aware of the early warning signs? Because it sounds like you're having to develop an instinct for when something is coming before it's really coming in your face.
Yeah, you've hit the nail on the head, Kathy. Yes, exactly. Mm-hmm. What we try to develop is more of an awareness of our inner life.
Yeah.
The inner life is more in the present. It's now. Mm-hmm. Most of the time, our orientation is external. In the future, expectations and thinking about the future, and the past. Maybe fears, maybe regrets of the past, rethinking that conversation with a friend that didn't go so well, wish I could have done it differently. And we spend a lot of our time in the future or in the past.
Oh. Mm-hmm.
We spend less of our time right now in the present. So learning how to be comfortable with ourselves in the present is an important focus that we teach. And when we're able to spend more time in the present, that allows us to look inward. What's happening with my mind and my heart right now? Mm-hmm. What am I feeling? What are my sensations in my body? What are my emotions? What are my thoughts? And then when we begin to notice that they're not so going in the direction we want, in a positive direction, but they're more negative, I'm judging myself negatively. I'm judging others negatively. I'm starting to get angry. I'm starting to become jealous.
Oh, yes.
I'm starting to become righteous. Or I'm putting myself down. You know, these things are common. We have these a lot.
Yeah.
And often we don't recognize. So we're training people to begin to recognize those things by staying in the present, looking inward, just looking, observing. And slowly we train people to then not judge. Not judge ourselves, not put ourselves down, not judge others, but just observe. Just observe when things are happening. And slowly that judgment, you know, self-judgment, negative judgment of others will start to slowly calm down just by recognizing it.
So it really will melt away
happens.
with practice.
It will melt away. It won't be quick.
Yeah.
You know, there are no shortcuts.
Yeah.
One has to do the work. Although recently, last night, I was told there is a shortcut.
Oh.
And this was told to Walter, who I saw last night, to him by Dzongtsar Khyentse Rinpoche. And he said that the shortcut is patience.
Patience. Okay.
So it's another way of saying there is no shortcut. We need to be patient.
No.
We need to do the work, you know, in this case, to train to be more present, to be mindful, to look in, to see what's happening, what are our thoughts, our feelings, our emotions, our sensations, and then to, you know, reset our course based on what we see right now is happening.
Right. It's almost like counting to 10 before taking an action that might potentially be negative.
That's part of it.
Patience is almost like a holding pattern space.
It is. There's also an active side of patience,
right,
which engages us in the positive counterpart. For example, if we recognize, oh, I'm starting to feel jealous. What's going on here? Well, I'm with a friend that just got a raise.
Oh.
And I'm telling myself it should have been me.
Okay.
And I get jealous of that friend that got the raise. If I notice that's happening, what I can consciously decide to do is rather than get jealous, doesn't hurt the other person. In fact, it hurts me. It closes my heart. Doesn't help me at all. It hurts me. Closes my heart. So thinking this way, okay, it's not healthy, getting jealous. I have an option. I have a choice. I can practice rejoicing. Rejoicing means I can practice being happy with my friend's raise. And I can tell my friend, wow, great, I'm so happy for you. You got a raise. This is going to help you, help your family, etc. And by just doing that, I feel good.
Yes. It almost seems to release your previous negative moment.
Exactly.
Where you were feeling shortchanged or why not me?
Exactly. And in that sense, that's the active part.
You've turned it around.
Of patience.
Yes.
Or of getting jealous. So being compassionate is not just something, sometimes I say, people think of it as a Hokkaido eggplant. Do you guys get Hokkaido eggplants here? They're delicious.
Okay.
They're grown in northern Japan.
Right.
And they're delicious eggplants. You know, the soil is very fertile. It's organic and wonderful. So some people think that that being compassionate is like Hokkaido eggplant. You know, limp.
Right.
You don't, inactive, passive, you don't do anything. Actually, the opposite is true. Compassion requires a tremendous amount of courage, a tremendous amount of strength, a tremendous amount of self-confidence. Not self-confidence that's egotistical, that's arrogant. Of course not a self-confidence that puts ourselves down, but it's a healthy, balanced self-confidence. All that is required for practicing compassion. So it's a very active state of being, not like a passive, limp Hokkaido eggplant.
No, I mean, you've actually reframed it in a very nice way today, that it's not just being kind and being gentle. I mean, those are also nice and important too, but it's learning what to do with the natural and negative sides of human nature, and how, as you say, to proactively learn to manage that better.
Exactly. And as you're suggesting, it's not always gentle and kind. Sometimes it's wrathful. It's a little bit like a parent towards a child. I'm not talking about beating a child. I don't believe in that.
No.
but guiding the child, sometimes who won't listen, with force. Being strong in our guidance to the child.
Is actually compassionate.
With a motivation
right.
out of love and wanting the best for the child, then it's compassion and love. If we have a mixed, or if we've been treated badly by our parents and we're tending to do that to our kids and acting wrathfully out of a negative, more harmful motivation, that's not what I'm talking about.
Right.
Talking about the motivation of love and compassion, of really caring for that person. The example is the parent and the child, but sometimes having to be forceful in the guidance, in the discipline of the child, not physically, but, trying to, guide that child in a strong way, sometimes is necessary to keep them from going in a wrong direction. And similarly with compassion, sometimes that's necessary. Now, it's not done in a righteous way. I know better than you. Not that way.
Okay.
It's done out of this balanced self-confidence.
Right.
And some knowledge. There's a lot of skill that's required here. We call that wisdom.
Right.
Yeah? And a lot of skill that's required here. If we're going to be strong and forceful with our guidance, we have to be right. Yeah?
Right.
If we're wrong, we can harm the other person, harm ourselves. So it takes a lot of skill. And therefore, wisdom is also a very essential part of the Buddhist path. And now we're talking more, on a secular, non-religious, non-spiritual, or non-religious level. Wisdom also is important in that context, too, to be skillful.
Right. It's interesting you talk about the force of the parenting strength. I know many people that are parents of teenagers right now, and it's a very difficult period of development to navigate through as a parent. And parents often think, how do I compassionately help my children, but with force, with a minimal of anger if they can help it? And it sounds to me like they need to look at their intent and how they're actually trying to parent the teenagers and guide them through, because the teenagers naturally are quite angry and explosive and unpredictable. Do you have any suggestions for parents of teenagers in how to stay steady through this rocky period?
Yeah. Well, I'm not a parent myself. I have no children.
Yeah.
So I may not be the best one to ask.
Yeah.
But on that side of steadiness from the parent, that I can help with. I think you're exactly right. You suggested looking inward, checking our intention, our motivation. That's always very, very important. Because many times in difficult, parenting situations, difficult situations in life regardless, but here we're talking about parenting teenagers, we get mixed up. Because we get mixed up with the parenting we receive from our parents. And we may not be aware of that.
Oh.
And so to look in and to see our intention, our motivation, and to see what's kind of guiding us at this difficult point with an acting out teenager is very, very useful. Not to put ourselves down, that's not helpful, but to be knowledgeable of what our intentions are, to clarify for ourselves our intentions. Many times our intentions are not pure. It's very difficult to have pure intentions all the time, or particularly in difficult situations. They're mixed usually, and that's okay. We don't need to feel guilty. Very, very important. We don't need to feel guilty. We're not perfect. If we were perfect, we wouldn't be looking for ways to better our lives.
Right.
So none of us are perfect. At least I don't think so. I'm certainly not perfect. So expectation for perfection is unrealistic, not necessary. It just leads to a lot of sense of failure and guilt. That doesn't help us. We can try slowly to let go of that. And the way we do it is first to identify it. Often we're not aware of it. So to identify the different parts of our motivation in dealing with our acting out teenage daughter or son
Right.
is very, very important. And then to be able to create some space between those emotions we have regarding our teenage child or young adult and ourself, and not to identify with those emotions as ourself, but rather to create some distance, to be a bit of an observer on this, to watch those emotions over there, a little bit like a white cloud
Right.
going through the blue sky.
The storming teenage cloud.
That's it. And just
Right.
watch it. And eventually, going through the sky, it's going to dissipate. It'll
Right.
come again.
Yes,
Yeah.
because the moods do change a lot.
They do.
Yeah.
They do. And so being able to see our emotional content related to our acting out teenager, okay, as a cloud in the sky moving across the sky gives us some room, some space, some distance from that emotion, our emotion. And so that we don't have to be so tightly clinging and identifying with that emotion as me.
Right.
And that helps us to maintain that steadiness, that evenness that you were asking about.
And as you say, not absorb too much sort of guilt or blame. And that goes back to the self and a poor image of a self as a parent in allowing the child the space to develop.
Exactly. That sense of low self-esteem or poor image of ourself is rampant in the world. It's rampant in modern society.
No, and are we inadvertently passing that on to our children if we don't pay attention and learn for ourselves what the self-esteem issues are?
Yes, exactly. And maybe that was passed down to us from our parents, very possibly. So to recognize these feelings, these thoughts, these attitudes in ourself is extremely important, not only for our own well-being, but also for our children's well-being, because we don't need to pass this stuff down to our children.
No.
Because we recognize it creates problems for us. We love our children. We don't want to pass this down to our children. So the first, I think, thing to do is to begin to start to look in and recognize when we're judging ourselves negatively, when we feel we're inadequate, when we feel we're not such a good person, to recognize those thoughts and feelings and see them like the sky going through the cloud going through the sky. Create some distance. Don't identify or try not to identify so strongly. And then slowly those things will have less of power over us, those feelings of inadequacy and putting ourselves down. And by doing that, we can then also begin to factor that aspect of ourself, which we're beginning to reduce, out of our education and our model for our children, so that our children don't need to be burdened with that same kind of low self-esteem.
Yeah. My goodness. Compassion took on a brand new meaning today. Thank you for sharing all of that.
You're very welcome.
You know, it's a very dedicated process that you're going through, helping people learn more about compassion, learn about the methods and the practical use and what it is, the depth of what it is, and how to develop more self-awareness. I think that comes from the Buddhist teachings, though, so much, because it's coming through about learning what goes on in our mind and how we react to the world around us.
Exactly. And so these kind of activities we've been talking about in terms of compassion are what the Human Values Institute is all about in Japan. And we have many more activities. We do, as I mentioned, have website in English and Japanese,
Right.
humanvaluesinstitute.org. And also we're doing meditation retreats, anywhere from 2 to 5 days. I give lectures across all of Japan, and not only to health professionals, but to many different groups of people. And
Your talks are conducted in English?
yes.
And Japanese, or are they translated during the talks also?
Yes, all my talks are translated into Japanese.
Yeah.
We have a very good translator who's been working with me for about 5-6 years as a translator.
Right. And you have study materials in Japanese and English
We've
for
published-
people to follow up on this?
Yes, we've published one book. We have a second book that's now being polished and will be published soon in Japanese language.
Right.
We're working as we develop more resources, which we don't really have, for more staff. We have
Right.
people ready, but we just need
Yeah.
the resources. Then to publish these in English. We have a DVD that's coming out shortly. We have on one of our symposium, which can be found on the website humanvaluesinstitute.org. We also have another DVD on one of our meditation retreats and pilgrimages. So we have a number of things where we have an e-learning system that's been developed for the last 2 years. It's ready to go, and we're just starting to put material up on our e-learning
Okay.
part of
very
that same
helpful.
website. Yes.
I just have to speak one time out because that was the lunch bell, actually.
I see.
The little ting ting in the background was the lunch bell. Would you like to pause for lunch? Because the monastics are served first here at the temple.
I see.
And
Okay, sure.
that was your call.
Okay. Good. Good.